Hi everyone, my name is Alexis Anderson and my neurological condition is Pick's disease or frontotemporal dementia. Before I get into my PowerPoint, I'm going to be playing a 3-minute video about a family whose son was diagnosed at a rather young age. It's going to be talking about some of the early signs they saw and how they're dealing with it as a family. Now let's get into the video.
Dementia is a problem of the elderly, right? Generally that's true, but there is one form of the disease that can strike people when they are very young, in their 20s or even their teens. It's called frontotemporal dementia, or FTD, and while rare, it devastates lives by rapidly turning young, vital people into those who need constant care. More from Mayo Clinic.
And we were seeing our son disappear before our eyes, little bit by little bit.
Sue and Bill Bishop are watching a disease called frontotemporal dementia, or FTD, consume their son Brad. The brain disorder with no cure is changing him from a caring young man with a bright future into a person whose behavior is erratic, childlike, and at times inappropriate.
Who is it?
I don't know, let's check.
Who is it?
I'll have to see who's calling.
Who is it?
It's not Brad. It's Brad's body. Of course, even that's different.
Brad's first symptoms were subtle personality changes. He'd forget to return phone calls and emails. He'd act childlike in public, and he grew self-centered, a trait his parents say was completely out of character. And as the disease progressed, symptoms got much worse. Brad became agitated around people, and he couldn't control the urge to eat.
So we literally had to put locks around the fridge and freezer.
For more than a year, doctors did not know why this was happening.
When we were told that there was something rapidly, progressively attacking your son's brain, and we don't know what it is, I lost it.
Just going to check your reflexes here.
Then the Bishops met Mayo Clinic Dr. Brad Beauvais, an FTD specialist.
That's when we started on our journey. It was a long, painful journey, but at least now we know what Brad has.
But for the families, it's frankly a nightmare.
Dr. Beauvais says FTD affects the frontal and temporal lobes of the brain, which control things like judgment, language, and social behaviors. Research suggests that FTD is the result of malfunctioning proteins that cause your brain cells to die prematurely. This causes brain tissue to shrink. Medications help manage some symptoms of FTD, but at this point, nothing can stop it.
We want him safe. We want him happy.
As happy as we can make him, comfortable.
And the Bishops want others to know about FTD, so families can intervene early and get their loved ones the supportive care they need as they live with this devastating disease. Again, there's no cure for FTD. Some people live with it for many years. Others lose the battle more quickly. Dr. Beauvais says that there is hope for patients with FTD. As researchers learn more about how it affects the brain, they'll be able to tailor medications to hopefully slow the rate of progression, stop progression altogether, or even prevent it. For Medical Edge, I'm Vivian Williams.
Even though this video is a little older, I really like it because I feel like it really demonstrates how his life has changed since his diagnosis. I also want to point out that they said that the first symptoms were only minor changes to his personality, but even though they were minor, they were very noticeable to his family and friends. So now that we have a brief overview of what Pick's disease is, we are now going to get into more detail about the diagnosis, etiology, pathology, prevalence, related populations, risk factors, medical management, and lastly, the condition-related precautions. Pick's disease is a rare neurodegenerative frontotemporal dementia that affects the frontal and temporal lobes. It causes a destruction of nerve cells in the brain, which leads to issues with planning, judgment, emotional control, behavior, executive functioning, multitasking, language, and emotional response. Some symptoms are abrupt mood changes, compulsive behavior, poor social skills, and withdrawal from social interaction. Pick's disease is diagnosed by exclusion, which means they'll run tests to rule out other causes of dementia. They'll look at your symptoms, your health, and also your family's health to diagnose. The picture on the right just shows the location that is affected in frontotemporal dementia versus Alzheimer's disease. There's not very much information on the etiology of Pick's disease, Scientists do not know what causes the abnormal proteins in this disease, but they have found abnormal genes linked to PICS, and they do know that genetics play a role. We are now going to talk about the pathophysiology of PICS disease. It is caused by abnormal amounts or types of nerve cell proteins called tau. The tau will accumulate into spherical clumps known as PIC bodies, which are the pathological hallmark of the condition. They'll accumulate in the nerve cells of your brain's frontal and temporal lobes, which will cause the cells to die. Once the cells die, it causes the tissue to shrink, which then in turn leads to the symptoms of the dementia. The median duration of illness from onset to death is 6 to 8 years. Pictured at the top is what the brain looks like when they have frontal temporal dementia, and then the bottom picture is a picture of the PIC bodies. PICS disease or frontal temporal dementia remains poorly recognized and it is pretty rare. It affects 15 to 22 cases per 100,000 cases of dementia. That's about 5% of all dementia cases. It's the third most common dementia across all age groups, and it is the leading cause of early onset dementia. PICS disease is misdiagnosed, so most numbers probably underestimate the prevalence. I am now going to talk about the related populations of PICS disease. PICS disease is usually diagnosed between the ages of 40 and 65, but it has been seen in people as young as 20. This is why it's the leading cause of early onset, because it affects people at rather young ages for developing dementia. People of Scandinavian descent are at a slightly higher risk. Also, the gender distribution is 50-50, meaning that neither men nor women have a higher prevalence. I am now going to be talking about the related disorders or risk factors of PICS disease. There are no really known risk factors of PICS disease other than genetics, and having a family history of dementia can increase your risk. The medical management of PICS disease should start with getting tests conducted, such as MRIs, CT scans, or an EEG, to rule out other causes of dementia, such as dementia due to metabolic causes. The brain biopsy is the only test that can confirm that you have this condition. There is no specific treatment other than medications to help with the symptoms. For example, people are giving antidepressants to control their mood swings. They also recommend behavioral therapy to help control dangerous behaviors, and they stress how important support networks are. I have 2 condition-related precautions for PICS disease. The first being going to the doctors regularly because patients with dementia can't always express how they are feeling. The illness could go unrecognized or unnoticed for long periods of time, which isn't healthy. The second one is installing safety equipment around the house to prevent falls or unnecessary injuries that could lead them to the emergency room. Lastly, these are my references that I used. And next, you will be seeing my activity called PICS Disease Says. For my activity, we're going to be playing PICS Says. I'm going to read a statement, and if it's true, they're going to do the action that's stated at the beginning. So the first one, touch your toes if PICS disease says there are no risk factors other than family history. Good job. Put both hands in the air if PICS disease says it is only seen in older adults. Good job. Hop up and down if PICS disease says the most prominent symptom is memory loss. Good. Spin in a circle if PICS disease says there's no known treatment or cure for the condition. Nice job. Sit on the ground if PICS disease says common symptoms are abrupt mood changes, compulsive behavior, and poor social skills. Nice job. A couple more. Stand on one foot if PICS disease says it is more common than Alzheimer's. Okay. Put your hand on your head if PICS disease says the protein tau is abnormal. Good job. That concludes my presentation about PICS disease. I hope you learned something new about the condition and that you enjoyed my presentation. Thank you.